Hello everybody, thank you for liking all my videos on your favorite nuts Motorai on YouTube, and following me on your favorite your underscore favorite nuts on Instagram and on Facebook. Thank you very much, I really do appreciate. Now today's topic is hepatitis. So I know you might have heard a lot about hepatitis, some true, some not true. So today I'm going to shed more light, I'm going to elucidate on that topic, so please stay with me. So, as I rightly said, hepatitis come from the word hepa, liver. It has to do with liver. So titis, inflammatory condition. So hepatitis is an inflammatory condition of the liver. It is mostly caused by a virus, sometimes viral. We have other causes like alcoholic hepatitis. We also have autoimmune hepatitis. But before we start all these ones, liver is a very important organ in your system. You don't have two of it, so be careful and live a very healthy lifestyle. So liver is located at the right upper part of your abdomen. It does a lot of functions like excretion of bilirubin, production of bile, synthesis of glycogen, breakdown of glucose, storage of vitamins, ADEK, synthesis of blood protein like albumin, and synthesis of vitamins. So you sure don't know that if the liver is affected, then all these functions also will be affected. So now we have the viral type of hepatitis. So we have 5 types of it. We have A, B, C, D, and E. So hepatitis A is acute but it's short term, while B, C, D, they are chronic and they are ongoing, while E, it is mostly caused by let me say, when there is infection with hepatitis E virus. Mostly occurs in pregnant women too, but it occurs where there are poor sanitation. So as I was saying, hepatitis A can be caused by the infection with the hepatitis A virus, and it is most likely gotten from consumption of untreated water or food that has been contaminated with the feces of hepatitis A patient. So what causes hepatitis A is mostly consumption of food or water that has feces in it by a person that has hepatitis A virus. So hepatitis B is contracted is transmitted by infection with the hepatitis B virus, and it is common in bodily fluids like adrenal secretion, semen, and blood, by the injection needle, the one you use to give it to another person, sharing of razor, sharing of sharp objects, and having unprotected sexual intercourse. Now, hepatitis C is transmitted also by body contact, but this one is direct body contact, like blood. Do you understand me now? So hepatitis D also is contracted by direct contact with blood. That's the Delta virus. It is very dangerous type of hepatitis D. So an hepatitis D cannot be transmitted alone. It doesn't multiply on its own. It has to be with hepatitis B. So hepatitis B is like a combination of itself and hepatitis B. So now to the alcoholic hepatitis. Excessive consumption of alcohol really affects the kidney. When you're the liver, when you're taking this over time, it directly affect the liver cells, which can cause scarring and thickening of the liver and can lead to liver damage and cirrhosis. So then we are moving to autoimmune hepatitis. Autoimmune hepatitis, this is when the body takes the liver as an object of harm to the body and begins to produce large amounts of antibodies to kill it. Yes, that's the way our body is designed by God. So just when it notices any object that seems as if it's going to produce a lot of antibodies, to just fight it off, to ward it off. So it is thinking, the body is thinking the liver is a very harmful object. That's why it's doing such. So now we have symptoms of the liver disease. Symptoms of liver disease, they are numerous. We have flu-like symptoms, that's tiredness. We have headache. We have lower abdominal swelling. We have loss of appetite. We have jaundice, that's yellowing of the white eye, the eyes, and the yellowing of the skin. Now we have, what can we use? What can be done to prevent hepatitis? But before then, there can be complications of the liver disease, and it can lead to abdominal swelling called ascites. It can lead to hepatic encephalopathy. This is characterized by memory loss and fatigue, because there is a lot of ammonia in your brain cell. So you can also call hepatocellular carcinoma. This is another form of liver cancer. It causes liver cancer too. It causes kidney damage. The way our body is designed, it is interconnected, so it will affect the kidney also. We also have portal hypertension. So now, what can we use? What can we use to prevent and to even cure the hepatitis virus and the autoimmune and the alcoholic hepatitis, as I just said now? So what can do for hepatitis A? I said is consumption of contaminated water or food. Is that a bed rest? Your food is monitored closely. Then there's also vaccine for it. Before anything, you have to take the vaccine. There is for adults and there is for children. So hepatitis B also, it is prevention. Prevention is better than cure. So it's vaccine to prevent it. Vaccine. So chronic forms of hepatitis B can be treated with antiviral drugs, because we said viral hepatitis, right? So hepatitis C virus also, chronic and acute form of it, is treated with antiviral therapies with alongside some other medications. While hepatitis D virus, as of now, doesn't have any drug that really cures or can be treated with. Yes, so what you have to do is to take a vaccine of hepatitis B virus. Although there was a drug in 2013, study shows that alpha interferon was used, but it has a little effect on people, like 20 to 30%, 35% rather. So please take the hepatitis B vaccination, and even the C and even the A. Please, let's stay protected. The hepatitis virus is a very dangerous one. We don't want to have a swollen tummy. We don't want to look like the old version of ourselves. We don't want to look like something we don't really want to see ourselves like. Please. And another thing for alcoholic hepatitis, the solution is just to stop drinking of alcohol. Please stop drinking of alcohol. It causes thickening and liver cirrhosis over time. It causes liver damage. Now to the autoimmune hepatitis. Autoimmune hepatitis, as I rarely said, the body is working against the liver, producing a lot of antibodies to kill it. So now we have corticosteroids, the anti-inflammatory drugs, like prednisone, budesonide can be used, and immune suppressors too, like azotropine and imuran, is called imuran, and neural can also be used for the autoimmune hepatitis. Please, the most important thing is to take the hepatitis vaccine, the A, B, and C, and please stay clear of anything, consumption of water that has been contaminated. So I haven't talked about hepatitis E, pardon me. So the prevention is just, I've said A and E are caused by consumption of contaminated water. So, and it is common in Asia, some part of Asia, Africa, where they're under development. There's no access to potable water. So that's it for the end of today. I really appreciate you. I really appreciate for your time.